if somebody was.
Well, you're fine. Good afternoon. Thank you so much for joining. I see we've got a few more folks coming in.
We're so glad you're here. Grab yourself some water, your afternoon caffeine. We've turned the corner on our day and looking forward to a great conversation with you all. My name's Jen Morrell. Thank you so much for joining us for the May edition of Prevention Exchange. This is our space at the Ohio Center of Excellence for Behavioral Health Prevention and Promotion, really to learn with, grow with each other. Every month we feature a different topic where we invite an esteemed group of panelists to join us in a conversation around that month's topic or theme. So in May, there is a lot of work happening around healthy communities, healthy college campuses, especially as our academic year tends to wrap up. So the May theme is convening communities and colleges, aligned vision and aligned goals to support student mental health. So excited to share that we have not one or two, but three awesome experts with us on today's panel. But before I turn it over to Tessa to kick off the day, I just wanted to share a little bit of information about the Center of Excellence in case this is the first time you are joining us. We really do operate from that purposeful perspective of excellence. We don't take that word lightly. And we try to keep in mind the impacts of social and structural determinants of health as they impact local prevention practice in all of that we do. Oops, getting happy with the mouse here. Our purpose and mission is really to enhance the quality of life for all Ohioans. I think the reason we are all called to this work. And we do that, we work with federal, state, and local partners to really try to elevate and institutionalize those core components of prevention science. We work to diffuse and support the implementation of the many research-informed frameworks that guide our work. And it is our goal to become a central access point for Ohio's prevention professionals, whether you're looking to develop knowledge and skills, consider other perspectives related to prevention science. There are so many amazing resources out there, and there's no sense in reinventing the wheel, but we hope that by providing them and making them available in one central access point that saves our prevention professionals and those who are interested in prevention a lot of work in hunting them down. So there's a couple ways that you can connect with us, and I broke it up into a few slides so you're not scanning QR codes and flipping between screens. But the first is to receive our monthly newsletter. Our main newsletter just went out this morning. So if you're not receiving that, I invite you to scan that QR code or visit our website at the very bottom. It's no longer a Google document to sign up, a Google form. I know that was a barrier for a lot of folks working at the state level. So if you're not receiving our monthly newsletter, I hope you will sign up. So I'm going to turn it over to our esteemed moderator, Tessa Miracle. Tessa is part of the facilitation team for the Center of Excellence and is employed at the Pacific Institute for Research and Evaluation as a research scientist. So Tessa, thank you so much for getting us started today.
Absolutely. And thank you everyone for joining us. I want to just thank our panelists for sharing their time, their expertise, and their energy with us today. I'm ready. Let's just go ahead and dive in. So I'd like to invite our panelists to share some brief introductions. So would love to hear, your macro level work and some of your mission work around this space. And I think as we go through, we can just kind of follow the order of the slide. So James, are you comfortable unmuting and providing a brief introduction before we hand it off to Juliana and Jessica?
Well, I've never been on mute, so absolutely. I didn't do that part. Yeah. Hi, everyone. Good afternoon. My name is James Trevino. I'm with the Ohio Department of Mental Health and Addiction Services. I've been with the department for a little over 10 years now, and in the field of prevention for over 20. And I've overseen a multitude of federal and state grants, and I have a significant background in law enforcement. So right now, I'm overseeing several grants through Ohio Moss, and am the lead in college for the state. So that's where I'm at right now. Glad to be here.
Awesome, thank you. James, can you share, thank you so much for sharing your introduction. Would love to hear a little bit about the evolution of the funding, the infrastructure, and sort of this, group of individuals that were pulled together with Gears.
Sure, I can get right into that.
Yeah.
Okay, well, we all know that the director's high priority is ensuring that mental health, behavioral health services are on Ohio campuses. We have, what you're seeing in front of you are 4 different types of streaming of funding. OCI is a consistent funding, and it's a funding that we've worked in with partnership with Prevention Action Alliance for over 20 years now. We've been funding them. And this came about when Director Lucille Fleming from Odatis and Hope Taft convened campuses in Ohio to reduce high-risk drinking. There was 19 campuses at the time, and I believe, if Juliana can correct me, there's 68 OCI members at this point, and I'm sure she's going to talk a little bit about that later. But once again, consistent funding, providing technical assistance, working with the campuses. So that is, like I said, on the director's priority, we have that, and that infrastructure is in place. The next 3 funding streams are one-time funding. However, I have to say, the work that happened with those one-time fundings has made a significant dent in our work and moving forward. We had a lot of funds that came through when COVID funds came through. So we were able to really think outside the box and do a lot more than we initially, did through OCI. So it did open a lot of doors and a lot of thinking. And then, of course, it did create collaborations and partnerships that we didn't have before. And that in itself also is a very strong infrastructure. So if additional funding comes, next week, next year, we have a group like who I like to call the super team. We have the super team together that have came together, and we all tackled, what we wanted to do with these funds. So it's in place, and we're really happy about that. I think a lot of states don't have those things in place, so I think we're ahead of the game in that. CARES Act funding, this was a quick turnaround, and I found out yesterday we were the first in the nation to get these funds. And this was at the height of COVID, where students were really voicing their concerns about having high anxiety, depression, feeling isolated. So we got together with Prevention Action Alliance, and there was a quick turnaround. We were able to provide funds for these students. We put out letters of interest and contacted the campuses directly. So out of the 65 members at that time, I believe 31 campuses took advantage of it, and they received funding. And some of the implementation that included telehealth services, PPEs, distribution of nutritional assistance, support groups, student care packages. I know a lot of the students were just surprised that they were getting care packages to their dorm rooms. And at that time, we hinted and really started to develop the campus community partnerships and ensuring that the campuses themselves were not siloed. So we put that out there saying, we want to make sure that if you're receiving these funds, that you guys are all on the same page. So we had them develop committees among the campuses to meet together to make sure that the distribution of these funds would go out in a way where everybody was taking advantage of it. And then we ended up getting the GEARS funding, 8 to 10 months later. And with the GEARS funding, we were able to build off what the CARES work was doing. So once again, for the development of campus community partnerships, and more importantly, creating awareness of behavioral health services on campus. That was a big thing that we heard, students saying, I don't know where to go. I don't know where these services are. So we made that one of the significant things that the campuses had to do. And then, we put out an RFP for that. And with those, we were able to assist 12 campuses at $50,000 a piece. So that was the first round of GEARS funding. Then we worked with the Ohio Department of Higher Education, and they had some GEARS funding that was left over. So we were able to, what happened was we put out an RFP and 18 campuses applied, and we were only going to fund 12 based on the work that we know we were going to do. So we used the additional GEARS funding from ODHE with Carey Solar to go ahead and fund the other 5. So it ended up working out really, really good. So, and then because of the work we did, the department got some ARPA funding, and there were some that needed, that was available. And so they looked at us and said, hey, we have some ARPA funding. Do you want to replicate some of the work you did with Rise and Thrive? And I said, absolutely, yes. And then once again, that's where that infrastructure being in place we're able to do this, continue that work. And now we're able to continue that work with 5 more campuses. So it's all working in succession to where now we know it, we have a model in place and an infrastructure. So when we have additional funding, we're able to do this and replicate what we did. And it's turned out pretty great. And we had the OCI forum yesterday, and I did hear Chancellor Gardner hint at the fact that there may be some additional funding. And I hope that comes true, because like I said, we are ready to go.
Wonderful. Thank you, James. What a thorough overview of your background and your work in this space. So thank you for sharing that. Juliana, are you able to unmute and share an introduction, some of your macro level work and some of the mission work you've engaged in?
Sure. So my name is Juliana Fellows. I work at Prevention Action Alliance, and I manage the Ohio College Initiative, enhancing student wellness on campuses across Ohio. And if anyone is unaware, Ohio has the largest number of campuses within its state borders, and that's including public, private, satellite, regional, community. So there's, I think, over 100 campuses, if I'm, off the top of my head. But we also have, we did a very in-depth scan about a year ago to determine exactly how many campuses are within Ohio. That being said, I know that James just gave a little bit of background with OCI, and originally back in 1996, I believe, OCI was developed in response to a high-risk drinking event that resulted in some student deaths. And so OCI was developed to deter that from happening on other campuses across the state. Since then, though, OCI has evolved to embrace a much broader message and initiative to include overall mental health and wellness of students on campus, because we recognize that if students have good mental health, then that is a protective factor from other things like alcohol use or alcohol abuse. So on a macro level, meaning statewide, we do dabble a little bit in some national stuff as being part of a national consortium with other universities across the state that we share and gain information from. But statewide, we really focus on helping professionals on campus or in community partnerships with campuses to focus on what students need outside of academics. What is going to help them succeed? Because we know that, yes, academics are very important, but we know that helping them succeed sometimes goes beyond that, especially in light of the COVID pandemic. And I think the COVID pandemic helped shine some light, some even greater light on exactly what is student wellness and what are those deterrents and what are those risk factors, what are those protective factors. And the CARES Act, not only, I know James talked a little bit about it, not only was the state of Ohio the first to receive those funds, but the state of Ohio is also the first to distribute those funds in a way that would very specifically address the needs of students across campuses during this time when people were being sent home or stranded on campus or being isolated because they did contract COVID. So again, I just want to promote Ohio and how we are super responsive and forward thinking. In the chat, I also put the final report for the CARES funding. I also put a report in there about the GEARS funding and what came from that. So if anybody gets bored and wants to do some extra reading, help yourself. OCI, in addition to, we do have a membership. Membership is free right now. And James said we have about 68 members, and they range from anything to a small campus to a large campus. Like I said, we try to capture the entire state, I guess, look of what a campus could look like in Ohio. So we do have a variety of members. Including membership, which can be attached to if there's a funding opportunity that we get from OMAS. We like to share our funds to address student wellness. So if you are a member, then you have access to that funding. In addition, you also have access to a network of professionals that honestly can share all kinds of knowledge and professionalism around student wellness. We also host 2 events each year. One event is specifically for small campuses. We recognize that they have their own particular needs. So we do a Small Ohio Prevention Association annual meeting. Sorry, I'm thinking of all the letters of the acronym in my head. We have an annual meeting for small colleges, and we try to provide some professional development and networking time around a relevant topic. And then we also, as James said yesterday, actually, we held our virtual one-day forum. The forum is a much larger event, a more encompassing professional development educational opportunity for professionals who work on campus or off. Again, we're promoting those campus community partnerships. But we provide kind of a broader perspective of what is going on campuses for students and what is it we look at, what are their needs right now? What is relevant to them right now? So for example, we had a panel about Narcan on campus. The governor had released some opportunity for campuses to access Narcan, which is it's naloxone. And so campuses who may not be, ready to receive that or don't know what to do with them, we had some panelists who said, okay, this is our experience with it, and this is what we've discovered, and this is what's working well for us, and this is maybe who you need to connect with on your campus to make this product work for the safety of students and staff. We did also have a student panel that talked about their experience in accessing student mental health and wellness initiatives on campuses and services as well, and their thoughts and experiences around that. And so, yeah, that's kind of OCI on a macro level in a nutshell.
Well, thank you so much, Juliana. That's really helpful. And I, I appreciate each of our panelists sharing such robust feedback and information so far. So thank you for that.
Yeah.
Jessica, I'd like to invite you to provide your introduction with a little bit, an intro to your work. And I think what we'll see emerge is how these puzzle pieces come together. So I think as Jessica talks, we'll really be able to see the full picture that we have here. And I'm so excited to hear more from you.
Absolutely. Hello, everyone. And First of all, thank you, Tessa, for moderating this panel, and Jen in the Ohio Center of Excellence for Behavioral Health Prevention and Promotion for the opportunity to participate today. And I also just want to appreciate what James and Juliana has brought forth in terms of discussion. We certainly appreciate the partnership, right? And the opportunities for funding, and again, everything that has been shared. To your point, Tessa, I think will bring the puzzle pieces together really, really well. So my name is, again, Jessica Zavala, and I am director for the Ohio Program for Campus Safety and Mental Health. We are one of 3 coordinating centers of excellence, and we are based out of NeoMed, Northeast Ohio Medical University. Our center has a unique start, and I'd say it's unique because it was started out of a response to train campus law enforcement and security officers in crisis intervention training, or CIT. And I know James mentioned that he has a law enforcement background, so this may be familiar to him. As well as violence prevention training after the unfortunate tragedy at Virginia Tech University. However, it was 3 years later in 2010. We actually went on later to apply, and we did receive the SAMHSA Garrett Lee Smith Campus Suicide Prevention Funding. And if you are not aware about that funding, or if you've not heard of these funds, really the purpose of these funds is to support a comprehensive public health and evidence-based approach that enhances mental health for college students, including those who are at risk for suicide, depression, and serious mental illness. Again, these grant funds really assisted us to really kickstart providing many grants as really one of the facets that we're able to offer to support campus community partnerships. In all, we've provided more than $400,000 in funding to support collaboration of these partnerships across the state of Ohio for colleges and community organizations. And just to provide a few examples, we have seen some really, really unique examples come through for RFPs, such as requests for gatekeeper suicide prevention, gatekeeper trainings, QPR, question, persuade, refer, as well as mental health and depression screenings, and a host of mental health resource fairs and events on campus that not only provide students, but staff and faculty as well with resources and information related to wellness and mental health awareness. We also have a few other facets to our program, such as trainings. And so based on stakeholder feedback, from campus stakeholder feedback, we really provide topics of interest that, stakeholders tell us that they are seeing events and different things on campus. And so we have a monthly webinar series, and we have a YouTube channel. So if anyone has interest in seeing kind of relevant topics that we have offered over the past few years, you can go onto our YouTube channel, as well as we recently hosted our biennial conference, which was held in Columbus on May 18th. We are hoping to have some recordings available as well of that biennial conference, as well as offering in-person regional suicide prevention gatekeeper trainings for campus and community stakeholders. And one other piece that I'll mention regarding funding is that we are also very grateful to be part of the partnerships that James mentioned in terms of the CARES and the GEARS and those other pieces. So again, that's where I think the puzzle pieces really come together.
Absolutely. And excuse me, thank you all so much for sharing some insight into your work. Before we move on to talk about the programmatic success as well as aligning with campus culture, I do want to go back and briefly share in the chat a link that James did share with us earlier. So making sure that we're uplifting the additional resource provided by James, really about the Rise and Thrive initiative, if you want to find more information there. But as we move along on in our time together, we know that programmatic success really depends on our ability to understand and align with culture. In this case, we're aligning with campus culture, and we recognize how that is, our societal culture has shifted significantly in the last 10 years, and our campus cultures reflect that. They've shifted, and we're really moving beyond the idea of the quote traditional college students. So we see people accessing collegiate education at different points in time through different modalities. And we're really moving beyond the 18 to 22-year-old college student. Can you, Juliana and Jessica, share an example of how your programs have pivoted to make sure we're reaching our intended audience while being inclusive?
Yeah, I can touch on that. So one of the things that we have found, actually a couple things. One, we recognize that campuses are inundated right now. In particular, their counseling centers are inundated right now with students, no matter what their ages or background or experiences are with trying to access services. And we have been looking at reviewing and having discussions within the state, out of the state, with higher ed professionals about what is needed to help with this. We can't serve everybody. Our staff are at exhaustion points, or we've lost staff because of the COVID pandemic. We've lost funding and that sort of thing. So we've really started looking at how to expedite and kind of triage, if you will, how student wellness and counseling services can look on a campus in a different variety of ways. We know that students don't always come directly to counseling because they need the counseling ASAP, but they are experiencing some sort of distress. So what are those programs that can help students kind of navigate where they're at in their distress, from minor to severe, and what are those supports that campuses can implement to kind of negate overrun with their counseling staff? That being said, there is also more focus on social determinants of health for students. That being, we know that when students enter campus, they're not bringing just their individuality, but they're bringing all of their human experience with them that they've had previous to stepping on campus. And what does that look like? So what we are discovering, not just within Ohio, but beyond, is that when we are able to look at what some of those social determinants of health are for students, and campuses can also be readily actually preventative instead of reactionary. They can be preventative in their approach to helping students acclimate to either it's their new living arrangements or their new responsibilities from, young people coming on campus, young adults coming on campus. And now they have like, oh, I don't have someone to tell me every step of the way how I need to navigate my education, where I can go to hang out, what kind of, products and services can I engage with on campus, but also even beyond young adult age. It could be that person who is re-entering college from 10 years ago, 15 years ago. So examining like, what are those social determinants of health that we need to look at? How can we look at them? And then how can we apply them to help students navigate this experience of higher ed?
Wonderful, thank you. And I love the way you describe that, our human experience. We bring our people experience with us. Jessica, would love to hear from you before we hear from James, a little bit about how the opportunities presented by the change in demographics of our students and how we can maximize on those and what that engagement looks like.
Sure, absolutely. And I think I'll add certainly to somewhat what Juliana has shared, and also share a resource as well. And I think if anything, we have a case for prevention in higher education. And of course, what we know and what the research does show is that many students are in a time of transition, right? This could be their first time away from home, and loved ones, they are certainly facing new stressors. And according to experts, they are at a higher risk of behavioral health issues like depression and anxiety. Many students are also matriculating with more elevated behavioral health concerns. And also, according to the research, they are seeking services more than any time, especially within the past decade. Actually, in fact, according to the most recent Healthy Minds study research, the 2021-22 National Data Report, it showed that 47% of students identified with having a lifetime diagnosis of mental disorders, 44% depression, and 37% anxiety disorders. However, it's not an end all be all when it comes to those statistics. Those are just kind of some of the facts, again, in terms of what students are up against. Earlier, I did mention that regarding SAMHSA and the Garrett Lee Smith grant, and again, SAMHSA has an abundance of resources, and I'll drop here in the chat in a few seconds a link that I believe can be extremely helpful to those of you who are participating. And it's part of an evidence-based resource guide series. It's called Community Engagement of an Essential Component of an Effective and Equitable Substance Use Prevention System. And I'll repeat that because it's a long one, right? It's a community engagement of an essential component of an effective and equitable substance use prevention system. And this guide is really designed for practitioners, administrators, health professional educators, really probably a lot of you who are on this call right now. And it provides practical guidance for implementing and evaluating community engagement strategies and activities. And let me just say this. Substance use on campuses can be prevented, and colleges and universities can really be successful and successfully promote mental health awareness and wellness on their campus. Also, addressing the, I'll put my air quotes up, root causes of substance misuse. I know Juliana, excuse me, talked about, those social determinants of health, but addressing the root causes of substance misuse and mental health issues really improves the health and the academic outcomes of all students. And we also know that this provides more value to the return on investment for the entire campus community, including, most importantly, for students. So I'll go ahead and drop that link in the chat now.
Well, thank you, Jessica. I think Jen went ahead and took care of that for you.
Perfect.
So we brought it in the chat, and I really want to thank you for providing such a multifaceted view of this work, and really considering, we're aware of the social determinants of health, but how can we equitably work with, these challenges that folks are carrying around with them, and recognize that in this space. James, we'd love to hear from you a little bit as we're looking at this macro level work, and how, what it looks like when you mentioned this super team from Gears. So really looking at, how that super team can help you get the resources to the communities more quickly, meet those grant deliverables, and also give you a chance just to provide a little more, touch base again on that wonderful slide that you had shared with us earlier. And James, I'm so sorry, you are on mute.
Sorry about that. When you look at the link, you're going to be able to see all the partners that were involved, but actually, I'd like to give a quick shout out to who they are. There's the Ohio Department of Higher Education, Prevention Action Alliance, Prevention First, Ohio University, the Higher Education Center, Neomed, PIRE. Those were the entities that we got together, and I have to say that we reached out and said, hey, we have these funds, we have a short time to turn around. We know that you all have experience working with colleges. So can we all come together to make this happen? And they all graciously came. It was everybody was like, yes, we can. And then we started talking about what the vision looked like, what responsibilities each agency would take on, and a few minor bumps here and there. Other than that, it ran like clockwork. Everybody did what they were supposed to do, and it's pretty fantastic. It actually got some from the International Town Gown Association. It got some national coverage. So Prevention First is actually on their way to Colorado in June to the International Town Gown Association annual meeting, and they're going to be talking about Rise and Thrive and what happened, and with the hopes that other institutions around the United States will follow what we did. So just beyond happy, because I'm always the first one to say I love working with these partners. Everybody's so great, and they just make hard things look easy. And it's just important to have that infrastructure in place. And with tragedy came opportunity. With COVID, I think a lot of the stuff wouldn't have happened if it wasn't for all these additional funds that was going out to support behavioral health and mental health in colleges. And I think the big push was for the first time, students who normally weren't feeling like that or normally wouldn't come, take a step forward and say, hey, I'm feeling like this. They were also isolated in the dorms. They were also feeling these feelings that they probably could have been coping with prior to, but then they said, hey, I'm feeling like this too. So not only did that come forward, but then they were able to identify with somebody else who was feeling like that the majority of the time, having anxiety. This person may have never had anxiety before, but then now they're saying, I understand how you feel. So a lot more students were just open up to understanding that.
Absolutely. And I love that reframe and shift. So thank you for that, James. I want to thank all of our panelists for sharing your experience in this format. So as we heard from you, we saw these puzzle pieces coming together, but we'd like to provide the opportunity to our attendees to ask some informal questions of you in some breakout rooms. So we recognize sometimes in this large group setting, folks don't, it's a little uncomfortable to unmute. Maybe I have a question that I don't want recorded on the webinar today. So what we're going to do is we're going to open up a few breakout rooms and let you self-select as an attendee. So if you would like to join James, we'll have you go to room 1, and we're really going to talk about what it looks like to build that network of partners, even when funding isn't there. In room 2, you'll be joining Juliana in addressing social determinants of health in campus and community-based work. And then in room 3 with Jessica is building those relationships between campus and community. So I'm going to go ahead and open all these rooms. We are going to give you about 6 or 7 minutes in here, and we'll come back together, do a really quick report out, and move on to closing comments. So your breakout room choices are on the slide there. I want to remind folks that the breakout rooms are not recorded, and you do get to self-select in. So if you have not seen a little notification pop up saying join the breakout room, you probably want to look at that bottom Zoom ribbon, and you'll be able to see there's one icon that kind of has 4 little squares on top of each other. That's where you can see the breakout rooms. If that's not the version of Zoom you have, if you look at that bottom ribbon right to the left of the end or the leave button, you'll see 3 dots, and that's where you can choose to join your breakout rooms there. If all else fails, if you have trouble, raise your hand. Jen, Owen, or myself can assign you to a room. So just want to invite folks to go ahead and hop into those breakout rooms. So thank you very much for your time and attention today. And thank you to our panelists. Wonderful. Thank you everyone for joining and coming back to share out with us. So we'd love to hear from you if you're comfortable sharing just a few aha moments. So what did you find most impactful, either from your breakout room or from today's session? Would welcome you to unmute or share in the chat what was most meaningful to you. It's going to be a shy day. That's all right. Anyone from breakout room 1 want to share a little bit of an aha moment, or maybe just a highlight of your conversation?
Well, this is Molly. I'll highlight from our conversation in room 1.
Thank you.
I think it's just great that this is all about working with college age youth and all of that, and having so many community prevention providers and boards involved in this prevention exchange is, I think, just so helpful as we work towards that campus community partnership that we want to build across the state. So I appreciate that.
Thank you for sharing. And I love that we are focused on this population. I think it's one that, it's just so vital to focus on. Room 2, would anyone like to share?
Sure, I'll speak on it. One of the things that I found to be very interesting was some of the out-of-the-box strategies that have been developed and implemented within the housing community off campus. And then the fact that they created this more structured environment, not only to reduce the defiant behavior of, oh, you can't tell me I can't do that, as well as the success of it, being that the buy-in from the students and the expectations within that community surrounding that off-campus housing. That was really, really interesting to me.
Absolutely. Thank you, Dr. Marquita. And I agree with you. I think, I know when I was a college student, off-campus housing wasn't something that, people talked about when delivering services. It was sort of like we were just over here hanging out. Absolutely. Room 3, you guys were the most popular group. I think we had almost double the amount of folks in room 3. So can you, is someone comfortable unmuting, telling us a little bit of the highlight of your conversation?
Hi, I'm Pam Hubbard from Golden Ciphers, and I found it very interesting because I am located right between Tri-C Community College and Cleveland State, and I have interns from both of them, but never ever considered using prevention strategies to provide programming or develop a program for the campuses. So thank you for this.
Oh, wonderful. Thank you so much for joining us. I'm so thankful that you chose to spend your time with us today. And I do see in the chat, Catherine has shared, I just love hearing about all these programs directed to our youth. Absolutely. Youth and young adults, just such a wonderful group to empower and to work with. Were there any other highlights that folks would like to share with us, or any, as Jen has labeled them, aha moments you'd like to share?
I'll share one. I love seeing the amount of people in today's session. I think about, where we were at pre-COVID, where we were at 10 years ago, where I was at, what, it looked like when I was in college. So different. And to me, this shows that, one, people are taking prevention much more seriously. And two, that they are wanting and desire to make those campus community connections. That's my aha.
Yes, wonderful. Yes, I love seeing the number of folks here. All right. Well, thank you everyone for being so candid and so open in conversation today. I want to thank our panelists for sharing your time, your energy, and just all of your knowledge with us. I'm going to hand this back to Jen for some wrap up and some reminder of evaluation.
Thanks so much, Tessa. Let me put my camera back on. There we go. Well, we're so glad that you joined us for the last 54 minutes. And one of the things that stuck out to me, I'm going to share my aha moment with you all, is that during the prep for this session, I think it was very clear to me. And Jessica did a nice job of kind of reminding all of us that with so many college campuses in the state, however you define college, right? Institution of higher education, vocational school, community college, regional campus, our larger, public universities, private, they all look so different. And very much like the communities we work in across the state, every campus has their own culture, and there are subsets of cultures among students and staff within that, campus culture. So the importance of really understanding who you're trying to work with is just kind of back to the basics, right? It can't be understated. And I would venture to guess that at the very least, you didn't have enough time to really dig into some of that in other conversations, but it might have been touched on room 3. And so, that's something that's going to, is a nice reminder to me. So I figured I'd elevate that all to share with the group. But as I promised you, we have a second slide with how you can connect with us. You have the Center of Excellence's website. So if you haven't visited that recently, we've updated some events. If you'd like us to highlight one of the events you are hosting in your area that's open for prevention professionals, we like to focus on ones that are open to all in Ohio, but certainly let us know. We like to elevate good work. And then follow us. We're on Facebook, Twitter, Instagram, and LinkedIn. So if you're not following us yet, we'd love if you just hit like or subscribe or follow, however that works on your preferred channel. And then finally, we can't plan these sessions without your feedback. So please do show us, tell us what you think. Show your speakers, our panelists, some love and respect, and thank them for their time by providing some feedback to us. It's a quick 3 or 4 question evaluation, but it really does make a difference in our future programming. So these are a monthly series. As you probably know, they happen on the last Thursday of the month from 1 to 2 p.m. So our next session will be Thursday, June 29th. We're still firming up a couple of details. So as soon as we have that ready, you can expect to see that in our newsletter, our social media channels. We'll get it out in News Now, and we look forward to hopefully connecting with you in a month. Hope your summer's off to a great start, and we'll talk soon.
Thank you. It was a pleasure.
Bye.
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 Thank you. Goodbye.